Live from Eyewitness News, this is breaking news.
Governor Gov.Raimondo is giving her daily coronavirus update right now. Let's listen in live.
Beginning of a new week. I hope everybody has a chance to get outside today. It's a very beautiful day. It's warm. Get some vitamin D with the sun. Go for a walk around the block. It's a beautiful day, and I hope everyone can enjoy it. I want to remind everybody that tomorrow's press conference is going to be at 3 o'clock instead of 1 o'clock. This week, every day, I hope to provide quite a bit of information about the reopening of our economy. So if you can tune in, I would encourage you to do so. Tomorrow will be at 3 o'clock, and then every day thereafter at 1 o'clock, as we do regularly. As you can see on the screen, they're going to put the data up on the screen. We have 188 new cases of coronavirus today, and very sadly, 24 additional deaths. This is the highest single day of a death count, 24. It's obviously a sad day, and I just want all of us to take a minute to remember the lives lost and say a prayer or send your best thoughts and strength to the families who are going through this. Dr. McDonald will give an update shortly on the details of the cases, hospitalizations, and mortalities. I began by commenting on the nice weather today. It's a great thing to get outside, but please don't congregate. It is so tempting to have some friends over, get together in a big group, go play ball in the park, let your kids hang out with a bunch of friends in the park. And I'm just asking you please to not do that. Hang in there a little bit longer and it'll keep all of us safe. As I noted yesterday, it seems like people did congregate over the Easter Passover holiday, no doubt in their homes, Easter and Seder. And then what we saw 2 weeks after that was a marked increase in hospitalization. So let's hunker down to the extent possible today so that 2 weeks from now we don't see any unfortunate increase in hospitalizations. Also, I'll say this. You probably will be outside today. You will, maybe you do some errands today. Maybe you're going to go pick up something at the garden shop. Please keep your contact tracing notebook. It's a gentle reminder. Do it every day. Write down where you've been, who you've been in contact with. It'll take you 30 seconds, and it could save a life. So I'm asking you, please, do your part today. Make it a great day. Keep your distance, wear your mask, and keep your contact tracing notebook. Today I'm very pleased to announce that Rhode Island will be collaborating with our neighboring states as needed to purchase personal protective equipment and other medical supplies. We're going to be working with our neighbors in Connecticut, Massachusetts, New York, New Jersey, Delaware, and Pennsylvania. Together, we're going to identify our region's needs for medical supplies and PPE, and we're going to work together in collaboration to secure everything we need at the best price possible and stabilize our supply chain. We've all learned, every governor who's been living this for the past couple of months knows how hard it is to get your hands on the PPE you need at the price that you're willing to pay exactly when you need it. And that's going to be so important to keep everybody safe as we enter this next phase of reopening workplaces. President Trump has been crystal clear that governors are on the front line of this, and we have to do the work of our state and go into the private market and secure this PPE. I have been doing that with the excellent team here and the assistance of the National Guard. As a result, we have been, in relatively good shape, but it's been very, very, very difficult. I mean, we spend hours a day, every day, as I've said, scouring the world to try to secure PPE. And at this stage, now that we want to allow people to start going back to work, going out to eat again, eventually going back to school, we need a steady supply chain. So I have decided to join this coalition of other governors. The thought is that right now we're all competing against each other. So I'm out there on behalf of Rhode Island, these other governors are too, and often we bid against each other and bid up the price. So the thought is that we had a good meeting today and in recent days to try to figure out how we can collaborate, do more bulk purchasing, which will keep the price down. We'll be competing less with one another, stabilize our supply chain, and make sure that at any given time we have at least 2 weeks, 3 weeks, 4 weeks of PPE that we need. So this, I hope this gives you a sense of confidence, and especially if you're a healthcare worker, maybe breathe a little sigh of relief. We're talking about gowns, ventilators, N95 masks, surgical masks, gloves, all kinds of medical supplies. So I look forward to working with my fellow governors, and I just want to again thank the awesome team that we have here in Rhode Island. They have been working 7 days a week, 15, 16, 17 hours a day for the past couple of months, getting the supplies we need. And they've been doing a phenomenal job keeping Rhode Islanders safe, healthy, and alive because of it. So I want to thank them for their work, thank the National Guard, and let Rhode Island know we're being proactive to make sure, as we open the economy, we're going to keep you safe. I want you to have some confidence we're doing everything we know how to do. A week from today is Mother's Day. Hopefully we'll have weather like today, and we're all going to want to be with our mothers. Hopefully, if things go well, that will be the first day that I will have lifted our stay-at-home order. But I want to, I'm saying it today so everyone can start thinking ahead. It's not going to be an opportunity to get together with a big family gathering as we normally would on Mother's Day. It's not going to be a day to go visit your mom in a nursing home or assisted living. Even if I lift the stay-at-home order, we're still going to be very limited in our ability to do social gatherings in groups. There will still not be visitation to nursing homes and assisted living and hospitals. And we're going to have to pay extra special attention to take care of our loved ones who might be much older and also have underlying health conditions. So I'm saying this because it's a special day. We all cherish our mothers. I know I do. And so start thinking now about how we can love and honor our mothers and our sisters and godmothers and people in our lives who've been like our mothers without actually seeing them, because it's very possible that you're not going to be able to see your mom if she doesn't live with you, or if she's in a communal living arrangement, or just start thinking ahead now, because I'm a little worried that since that's going to be the first day that we lift the stay-at-home order, and it's a day we're all going to really want to be with our moms, but we can't be. I want you to think about it now so we can enjoy Mother's Day, but do it in a safe way. Finally, I want to end my comments this morning on a happy note and a light note. As you know, I issued an April reading challenge to all the kids in Rhode Island, and of course this past Thursday marked the end of April. I'm going to give you some information that should make you so proud of our school kids here in the state of Rhode Island. So throughout the month of April, more than 21,000 students logged more than 1 million minutes of reading. I think that's fantastic. A few weeks ago, I announced that Barnes & Noble would be donating a set of new books to schools with the highest participation rate in the challenge. And so I'm excited right now to announce the winners of the challenge, the winning schools in each division. A big congratulations to the Westerly Inclusion Preschool, Babcock Hill. Huge congratulations to the Paul Cuffey Lower School in Providence. Way to go, Paul Cuffey. Portsmouth Middle School took the prize for middle schools, and Highlander Secondary Charter School in Providence. We're proud of everybody. We're extra proud of you guys. You knocked it out of the park with your reading, and I think that's fantastic. I want to thank public libraries and organizations across the state who've worked so hard to ensure that all of our kids, regardless of their zip code, regardless of their income, have had access to books. In particular, I want to recognize the Rhode Island Federation of Teachers for their generous donation of more than $10,000 to support the Reading Challenge. These funds are being used to purchase more than 7,000 books for families in our highest need communities. So thank you to the teachers and your leadership for that. I want to say two things. First, I'm going to speak to the children. Just because April's over, don't stop reading. My hope in doing this was that if you read every day, even a little bit every single day, you'd form a lifelong habit of reading. So see if you can keep it going for May. Even if you read 10 minutes a day, or maybe you could read a little bit more, a half hour, but it's a great thing if you can form a lifelong habit of reading. So you did it for April. You were terrific, 1,000,000 hours for a little state. Let's see if we can keep it going for May. And then to the teachers, I want to say thank you. This is pretty incredible that you're doing distance learning for 140,000 kids, taking care of your own children, many of you, and you're getting the job done. This week is Teacher Appreciation Week. I cannot think of a better time for each and every one of us to express our appreciation for our teachers out there. So let me begin Teacher Appreciation Week here on this Sunday with a huge thank you, debt of gratitude, and expression of my respect and admiration for all of our teachers, and ask each and every one of you out there in Rhode Island to find a way this week to say thanks to the teachers that are keeping us going through this crisis, and frankly, keep us going all year round. So with that, I'm going to turn it over to Dr. McDonald, and then we will come back to answer questions.
So thank you, Governor Raimondo. So good afternoon, Rhode Islanders and beyond. I'm Dr. Jim McDonald from the Rhode Island Department of Health, and I want to thank you for continuing to follow the Rhode Island story. So today we have 188 cases of the disease COVID-19 caused by the virus SARS-CoV-2. We have 330 people right now currently in the hospital. Of those folks, 83 are in the intensive care unit and 59 are on ventilators. The governor mentioned, regrettably, we have 24 of us who have passed away, and this is hard. I think just so it's not lost, realize that these are moms, these are dads, these are brothers, these are sisters, these are loved ones. And I was telling the governor before I walked in is that the pandemic's been more bitter than sweet, and you think about that. It's hard every day to talk about this, but I think we're just trying to be transparent and let folks know we grieve your loss. It's hard. The folks who passed away, 18 of them were in nursing homes. And of the people their age, one was in their 30s to their 90s. There was one person in their 30s, 3 in their 40s, 1 in their 50s, and 1 in their 60s, 2 in their 70s, and 8 were in their 80s, and 8 were in their 90s. So as we continue to partner with nursing homes to respond to the pandemic, we have another new nursing home that has agreed to become a COVID-19 specialty nursing home, and that's Oakland Grove in Woonsocket. This is in addition to Oak Hill Center in Pawtucket. Now, what it means to be a COVID specialty nursing home means is, as they help us support the response, that means when someone leaves a hospital and they need to go to a nursing home, and if they're COVID positive, then these 2 nursing homes have specialized resources and abilities to help take care of those folks. And it helps them to do the highest level of care possible. And it allows the patients to leave the hospital, so we free up capacity as well in the hospital. The current residents at Oakland Grove who do not have COVID-19 will be located in a separate unit of the facility, and so they're not moving anywhere necessarily. And residents at other nursing homes who have COVID-19 will remain at their current nursing homes. We are working as much as we can with nursing homes to help them manage the crisis, and we know the pandemic's been hardest for the nursing homes. We're working with enhancing the personal protective equipment. We're doing a lot of testing in nursing homes. Whenever we have cases at nursing homes, we test the staff and the residents, and then we put them on a schedule to keep that under control so we know what's going on in the nursing homes. One of the people I want to thank in our response is Dr. Phil Chan. Dr. Chan is one of the consulting medical directors at the Rhode Island Department of Health. I'm actually humbled to be his colleague. He's brilliant, and he works with the nursing home medical directors, and just, the nursing home medical directors are trying to find treatments that work. We're trying to see what we can do. One of the things that's hard about this pandemic is there is no effective treatment right now. And it just seems like that's a journey that's worth taking, and we're trying our best to find one. But right now, the research has to catch up to our reality. So that's a struggle we're with. I do want to thank the National Guard as well. I was talking to Colonel Ashley last week. They have a team going into nursing homes. They're doing training on infection prevention, other things that help with personal protective equipment. So we're seeing some strategies from the National Guard that are worthwhile as well. So I want to thank them as well. I'd like to talk about something else, though. I like to talk about common objects. You know, in the past, I've said whenever you touch a common object, you present risk of transmitting the virus. And I don't know if you're like me, but sometimes I don't see what's right in front of me. So last week, I'm in the house. I happened to be in the kids' bathroom. And I have 3 kids. They share a bathroom, right? And I saw the stuff on the bathroom counter, probably like you have in your home, too. So I came across this object here. So I brought a tube of toothpaste today. So why did I bring toothpaste today? It's not a product endorsement. What I'm trying to say is, like, I looked at this one tube of toothpaste and realized my kids share this toothpaste, like probably a lot of families do. And then I realized my kids are touching this object every day, multiple times a day. So I realized it's a common object in my own home. So I thought about what are things I could do to minimize the risk to my kids about this common and very commonplace object. So what I did was I assigned each kid a drawer in our little bathroom cupboard there, got each kid their own tube of toothpaste, asked them not to share their objects, and to get everything organized. And kind of what I explained to them was, well, you could put all your common objects away so that there's no risk of anybody spreading anything should anyone get it. And part of why that's important is one of the vexing problems of this little virus is it spreads when people feel fine. So you don't know when you're shedding virus. So we have to wear our masks. When everybody wears a mask in their bathroom, right? And so doing things like this, like minimizing the common objects, is one thing we can do. And so I think this is just an important little tip. Look for the common objects in your life. The governor talked about if you're going to go out and play ball, like I love to play baseball, but if you share a baseball with 17 other people, you share a common object with 17 other people. This isn't the right time to share common objects. Now, there's some structural changes that we can do, though, that minimize our use of common objects. Like one of the things I was thinking about was when I go buy things, so I have my little debit card here. So if I go buy something and I put the chip in, then the cashier doesn't have to touch anything. So that's actually helpful if you can have that. You know, and it minimizes this, and that's where going to resources like that actually help us to minimize the spread. I do want to take a moment just to talk about Mother's Day, because next Sunday is Mother's Day, and you know, it's important. I think one of the things we want to think about is, like, how do we show attention and favor to our mom in a way that's healthy for all of us, right? So maybe a phone call is the way to go. If you have the potential to do a video chat, maybe that's a better way to do it as well. I know I got my mom and dad a Facebook portal for Christmas last year. They figured out how to use it. I've kind of enjoyed it. You know what, we can just sit there and visit now. Like, they're sitting at their kitchen table. I'm sitting at my kitchen table. We're just chatting. That's kind of fun. You know, and I think it's important to think about, too, if your mom or grandma's in a nursing home, maybe not the best time to visit. You know, I know that's hard to hear, and trust me, it's hard to say. But we really want to just think about how can we connect with people creatively. You know, and I think it's hard. You know, I was thinking about this morning. It's kind of affecting me a little bit. Like, normally, Gail and I and the kids, we go visit my mom and dad in upstate New York. My mom and dad live in a small town outside of Albany called Cohoes. And so we go up there. You know, I have 5 brothers, and I know what you're thinking. I have 5 brothers, so you're probably thinking my poor mom. That's what everybody says. My mom's a very rich person in emotion and spirit. She's great, and she's fine. And she's very proud of her 6 sons. But I think I just think about last Mother's Day, we went up there. I wanted to plant a garden for my mom and dad. So, you know, it's a Saturday. They're out doing their thing. So me and the kids are out planting these annuals for them, and of course it's raining, but I got to have it in by Mother's Day morning, so because that's the way it works, right? So we plant this beautiful garden, and it was fun. You know, it came in cold and wet, but we got a beautiful garden for Mom, and they enjoyed it for the whole summer. But we can't do that this year, so I have to think of something else for my mom, and I can't tell you today what I have planned for my mom because my mom watches this, so I want to surprise my mom, but I want you to know that I'm going to surprise my mom with something creative because it's my mom, and I want to do something nice for her. And I think, you know, one of the things I think about my mom, and I bet this is true about your mom as well, is my mom always thought about my health first. And this is a chance for me to think about my mom's health first, too. And I think it's hard. And I just want to make sure you understand that it's really hard for me not to get together with my extended family because we love doing that kind of thing. But we'll be here instead in Rhode Island, and we'll figure out a way to make it special, and it will be okay. So I want to turn it back over to Governor Raimondo. Thank you.
Thank you so
Doctor.
much, Jim. That was great.
You're a good son. So we're going to begin today with this question from Christian Winthrop of the Newport Buzz. Governor, can you clear up some confusion regarding your quarantine order? Is it okay to make a day trip from Boston to Newport for a cruise around Ocean Drive if you absolutely, positively don't get out of the car for any reason except for gas, restroom breaks, Instagram selfies, food, and a brief walk?
Good question. I mean, that does sound fine to me. I would say a few things. What we've said about the quarantine is that if you're coming from another state to spend time in Rhode Island, maybe at your second home, maybe staying with friends, then we want you quarantined for 14 days while you're here. So if you're coming from Boston and you have a second home in Newport, fine, come here, let us know that you're here, and stay in quarantine for 14 days inside, in your house. If you're coming to Rhode Island to work, that's different. We understand you need to be here. We understand you need to work. The scenario you're saying, it sounds like the person's not coming to stay overnight, so they wouldn't be ordered into quarantine. They would have to follow all the rules that the rest of us are following, wearing their masks, staying 6 feet away from people, and the like. So the short answer is yes to your story. I would just say this to the people of Rhode Island. We have, I hope, another week of the stay-at-home order. I hope that in a week we'll be able to relax that. So I'm just asking you to do your very best to obey the order for the next week, however hard that may be.
In regard to the stay-at-home order, John DePietro asks, the stay-at-home order is set to end May 8th. If it is extended, what day would this what day this week would you announce it to be extended? Yeah,
great question. So right now, as I stand here, and we've been through all the data again this morning, been talking to the hospitals, today I would say the intention is as I've said, which is lift the stay-at-home order May 8th, May 9th. If that changes, it's kind of hard to answer your question because, if something happens into the week and I have to change my mind, then I will do that. So bottom line is, throughout managing this, I need to maintain flexibility to meet the conditions on the ground. I suppose it's conceivable that, right up until May 8th, I could change my mind. But that isn't the plan. As I've said from the beginning, we're working for the best. Right now, we're working like crazy to be able to lift it and getting everything in place, the testing, the PPE, the contact tracing, new regulations for retail and businesses. If at any point we have data which is so concerning that I either have to not lift it or frankly put it back in place, then that's what I'll have to do on that particular day.
Next question is, what role can the government play in rebuilding a sense of trust for consumers and workers to participate in an economy that cannot guarantee their safety or their jobs? That question's from Richard Asanoff of Convergence RI.
This is a question that is top of mind for me. Also top of mind for every business owner. In the past 3 days, I've talked to maybe 24 business owners, and this is their question, which is, even when the government says it's safe, our employees are afraid to come back. So I think the government can play a role in that. Number one, I can try to give you good information, when I can share with you, as I have been, why I think it's safe, why I would think it would be safe for me and my family to do this, and continue to be transparent as we have been. Number two, to put the conditions in place so that it is safe, right? Like, it wouldn't be safe if we all just went out tomorrow or when the stay-at-home order lifts and returned to life as it was. But we're not going to do that. We're going to have 30-day supply of PPE, adequate amount of testing, ability to quarantine and isolate everyone who needs to be, an ability to test the most vulnerable communities. so that we either prevent an outbreak, or if there is an outbreak, we're on it right away, you know, and on and on. So look, the fact of the matter is it's going to be gradual. That's why I'm referring to stage 1 as testing the waters. It's like anything, like we've been through a traumatic experience together and people are afraid. And I don't want to minimize that. It's valid to be anxious. It's valid to be afraid. Having said that, we also have to be courageous and brave. And when it's time to get back out there, having confidence that it's okay to do it, and that all the work we've been doing for 2 months is strengthening our system so that we can do it. And also, all of our behavior change, no more crowding together, for example, constant hand washing, mask wearing, that has to stick around until we have a vaccine or a cure.
Governor Ashley Cullinane of NBC 10 notes Rhode Island's child care assistant program already did not meet federal standards. What actions are being taken to protect child care providers and the future of the state's right from the start legislation package?
Yeah, it's a really good question, Ashley. I think, as I announced yesterday or the day before, I'd like to start to get child care centers back up and running by about June 1st. By June 1st. We've asked them all to give us their plans by May 22nd, and we want to have a limited reopening under new conditions June 1st. In order to do that, we're going to raise their rates. So all the CCAP child care centers are going to go up to the 5-star rate level to account for the fact that you know, they need to get paid for doing more work and a different kind of work. So that's a beginning, and we're going to keep our eye on it to make sure they get the support and funding that they need, since their job's going to get harder, not easier.
Our next question is from Anita Buffoni of WPRI. Bishop Tobin says he is getting a growing number of demands for churches to reopen. He said he hopes to do so by May 31st with restrictions. Are you planning to reopen churches soon? And last question is, what is your response to the faith community?
Yeah. So I want to say a few things. First, I want to thank Bishop Tobin and his team for being fantastic partners to me and my administration from day one in fighting this crisis. We are in, if not daily contact, you know, certainly weekly contact, and he's in a tough spot, as am I, because you're trying to balance so many competing demands. But he and his team have, you should know, been excellent partners and really trying to do the right thing. Secondly, I'm right there with you. I'm someone who goes to church faithfully every Sunday forever. It's a staple of my life. It's how our family stays close and observes. So it's brutally difficult to not be able to celebrate Mass at least once a week. We are in contact now. I think that's a reasonable goal. I can't promise it. It's a very reasonable goal. We're in touch with the diocese. By the way, not just the Catholic diocese. We're in touch with synagogues. We're in touch with mosques. We're in touch with the Episcopal diocese to try to figure out exactly what those restrictions will be. For example, we're not going to be able to have shared hymnals. Dr. McDonald just gave an excellent demonstration. You know, he had his toothpaste. The same can be said for a hymnal or a prayer book. There's going to have to be a lot more cleaning protocols. We're going to have to pay extra special attention to the elderly and the sick. We're going to have social distancing. So in any event, I think it's a good goal. We're going to work hard to see if it's achievable, and we're going to balance people's very real needs to practice their faith and be with their faith community against the public health crisis, which says that crowds are really the enemy. I mean, this virus thrives in crowds, particularly crowds of people where you have a lot of older folks. So we're going to get there, and we're going to work together and figure it out together.
Next question is about masks from Kate Walsh of WPRI 12. Not sure if the doctor wants to handle this or both.
I can do it.
Oh, yeah, that'd be great.
Doctor, do we need to wear masks when outside simply taking a walk? If so, is there scientific evidence showing this is necessary when we aren't in groups of people?
So thanks, Kate. So I was out taking a walk last night with my wife and kids and the 2 dogs. So Daisy and Rosebud love taking walks. I'm with them, right? So when we're out walking in the development, taking a walk, I have my mask on me. Like, I carry my mask with me here. I don't know if you can see it, but I carry it with me so that if I come across other people, then I can put my mask on. But when I'm out walking, I don't wear my mask because there's no one else around me. And just think about it this way. If you're hiking in the woods alone, there's no one else who's at risk. However, if you're walking among people where there's other people, then you do want to wear your mask, and that's socially acceptable now, and it's culturally acceptable now. When you talk about the scientific rationale, Kate, what I want to make sure we get our mind on is this, is when we're talking, if we're asymptomatically spreading the virus, then me simply talking could be having little viral particles right on my little folder here and right in this little space. Little viral particles all over the place here. If I'm talking right next to you, you could be having viral particles go through. So that's the scientific rationale. When I put my mask on, then the viral particles are staying inside this little spray and I'm reducing the spread. So that's the rationale. So I think for things like hiking in the woods, for walking where there's no one else around, I would have your mask on your person, but you don't need to wear it. Thank you, Kate.
Thank you. Bruce Newberry of Steve Alquist of Uprise RI has the next question.
Great question.
When you lift the stay-at-home order, will all the federal benefits that go with the COVID emergency evaporate? Could that adversely affect those who either can't go back to work or have no work to go back to?
Yeah, excellent question. The answer is no. No is the short answer. So if you're talking to people who worry about that, they can rest easy. I've also declared a state of emergency, along with 49 other governors. That does come with federal funding, federal reimbursement, federal money, federal FEMA reimbursement. So in addition to the fact that I think we are clearly still in an emergency, were that to be lifted, we would be at jeopardy of losing substantial federal monies, but that is the state of emergency, different from the stay-at-home order.
Our next question is from Bruce Newberry. Sorry about that, Bruce. Is there a possibility of federal dollars specifically directed to the restaurant industry as is being pushed on a national level? Since restaurants are not federally licensed, what about directing such dollars to state groups such as the Rhode Island Hospitality Association?
Yeah. Thank you, Bruce, for that question. This is something that is top of my list. In fact, Commerce Secretary Pryor and I had a phone call about this morning. Restaurants are really hurting, and we are talking to them every day. Obviously, not just in Rhode Island. This is a nationwide crisis. The Rhode Island Hospitality Association and Dale Venturini have been phenomenal. I want to personally thank Dale for being such an advocate for restaurants and hospitality groups. We are going to find a way to financially support restaurants. I don't know exactly how or how much. I hope the federal government, I know the federal government is thinking about it because it's a national problem. If they don't provide extra funds, my view is we have to find a way to use some of our COVID relief money statewide to help the Rhode Islanders, and whether we run that through the Hospitality Association or through Commerce, that's exactly the kind of work we're doing right now. But if you're owning a restaurant, I want you to know we are intensely aware of how challenging this is, and we're going to get very creative to support you to the best of our abilities.
And our last question today is from John DePietro. It's posed for either the governor or Dr. McDonald. Since COVID-19 can be airborne for a period of time, how can dentist offices clean the air so the next patient doesn't breathe the particles?
Yeah, so when the viral particles in the air, obviously they take time to subside down to optics. This is one of the challenges with opening up dental offices. So Dr. Sam Swetkenbaum, the state dental director, is working with us to help find out strategies that would work where we can actually reopen dental practices. Some of that might include testing people. It might also include changing the ventilation or HEPA filtration in dental offices. It might also include cleaning dental chairs in particular, or spaces that are common before the next patient comes in. So strategies like that will minimize the spread. Another thing that's really important though is if you have a cold or you feel like it's just something minor, then you really need to cancel a dental appointment. I know that can be hard sometimes because you might have had to wait, a few months to get the dental appointment, but we have to just right now think about others. And I think about one of the themes I'm drawing from this whole pandemic that I think is important is This is becoming a very other-oriented time, and I think as a culture, we need to look at people who are ill, who isolate, as heroes, doing their civic duty, doing the right thing, sacrificing of them because they have a minor illness and staying home. And I think we have to just start thinking about each other differently. I think we tend to look at people with colds as, oh, someone's got a cold, but when they're actually isolating, they're doing an act, a purposeful act to protect other people. And that other-oriented behavior is a really good human quality, so we want to encourage that kind of thing. Thank you.
Thank you. Hope you can enjoy the day.
We've been listening to Governor Raimondo and the Health Department give their daily update on coronavirus efforts here in Rhode Island. They said there were 188 new cases to report today and 24 additional deaths. 18 of those people in nursing homes and ranging in age from their 30s to their 90s. This was the highest number of deaths in a single day so far. Rhode Island is collaborating with other states in the northeast of the country to get PPE in a steady supply here in Rhode Island. The governor saying by working together, they'll be able to secure that amount and without any price gouging. They also announced that Oakland Grove Nursing Home in Woonsocket will be a new coronavirus specialty care center. And the governor said there's a goal of limited reopening of child care centers on June 1st, of course, with a lot of changes being made to keep everyone safe there. And when asked about churches reopening after the bishop announced he would like to have that later this month in a tweet, the governor said May 29th is a good goal for that, but they'll have to look into a lot of things and changes being made there as well. And then when asked about wearing masks out when just going for a walk, the health department said that if you're out in the woods by yourself, no one else is around, have it with you, but you don't need to wear it. But then, of course, if you are near other people, it's important to wear it to prevent spreading any germs you have to others. So that's our daily update here on coronavirus efforts, and you can get the very latest on our website at WPRI.com.
Stay with Eyewitness News for the latest on this breaking story.